Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Topiramate. Its brand name is Topamax. But before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So the exact mechanism of action of Topiramate is unknown, but there are 4 properties that are thought to contribute to its anti-epileptic as well as anti-migraine activity. One is a blockade of voltage-dependent sodium channels. Another is the augmentation of GABA at some subtype GABA-A receptors, antagonism at a subtype of glutamate receptors, and the inhibition of carbonic anhydrase enzymes. In terms of indications for use, it can be used as an adjunct therapy in primary generalized tonic-clonic seizures, and in this same situation, it can also be used as initial monotherapy. It can be used as an adjunct or again as initial monotherapy in partial seizures. It can be used for prophylaxis of migraines. And finally, it can be used as an adjunct therapy when treating Lennox-Gastaut syndrome. Now, before somebody was to use Topiramate or Topamax, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication will be contraindicated in patients who have used alcohol within 6 hours before using Topiramate. On the other end, you would also not be able to use alcohol for 6 hours after a dose of Topiramate. And it would also be contraindicated in patients who have metabolic acidosis who are using metformin. Now, in terms of precautions, Topiramate or Topamax is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. Because of the syncope, ataxia, and impaired motor function that this medication may cause in this population, it may put them at an increased risk of experiencing falls, and in this population, falls can sometimes lead to fractures. We would want to avoid using medications with Topiramate that induce metabolic acidosis, such as carbonic anhydrase inhibitors. Patients should be made aware that metabolic acidosis has occurred with the use of Topiramate, and it would happen more commonly in patients who have conditions or using therapies that would predispose them to acidosis. Hyperammonemia with or without encephalopathy has been reported with the use of this medication, both in patients who are using it with or without valproic acid. Oligohydrosis and hyperthermia has been reported, especially in younger patients. Hypothermia has also occurred, in some situations with a core body temperature less than 95 degrees Fahrenheit. And again, this has happened in patients both using Topiramate with or without valproic acid. There would be reduced Topiramate clearance in patients using it who have hepatic impairment. And abrupt withdrawal of this medication may increase the risk of seizures both in patients who have epilepsy and in patients who do not have epilepsy. Dose-related CNS depression has been reported. This would be more of a risk for patients who are using other CNS depressants. Cognitive-related dysfunctions have occurred, especially in patients who increase their dose rapidly and in patients who are using high doses. Acute myopia associated with angle closure glaucoma has been reported. In some situations, the medication may have to be discontinued if this occurs. Some patients have experienced visual field defects, not necessarily associated with an increase in intraocular pressure. Suicidal thoughts or suicidal behaviors may occur with the use of Topiramate, so patients should be monitored closely for any signs of suicidal ideation. Psychiatric and behavioral changes have been reported, including depression and mood changes. And finally, a dose adjustment may be required in patients who have moderate to severe renal impairment. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Topamax or Topiramate, they can expect to receive their dose in either tablet or capsule form. When somebody is using Topiramate for initial monotherapy with a partial seizure, they would start off by using 25 milligrams twice daily in the first week. During the second week, they would increase their dose to 50 milligrams twice daily. They would then increase each week to 75 milligrams twice daily, 100 milligrams twice daily, 150 milligrams twice daily, until they reach 200 milligrams twice daily. 200 milligrams twice daily would be the maximum dose in this situation. And of course, a physician may decide to stop the titration along the way up to 200 milligrams and stop somewhere at, for example, 150 or 175 twice daily. When a patient is using Topiramate for migraine prophylaxis, the typical maintenance dose would be 100 milligrams daily given in divided doses. Now, the patient wouldn't start off using 100 milligrams a day. They would titrate up slowly, similar to what we just discussed with the partial seizure dosing. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Topiramate or Topamax, so I'll go over some of those here now. About 5% of pediatric patients experience flushing. Anywhere from 25% to 67% of patients may notice an abnormal sodium bicarbonate level. 10 to 24% of patients may notice a loss of appetite. 4 to 21% of patients may experience a decrease in weight. Anywhere from 2 to 8% of patients may develop an infectious disease while using Topiramate. Confusion can happen up to 11% of the time, and dizziness up to 25% of the time. 2 to 7% of patients may experience impaired cognition. 3 to 12% of patients may experience memory impairment. Somnolence can occur between 6 and 29% of the time. 4 to 16% of patients may develop a feeling of nervousness. And 4 to 11 may develop a mood disorder. Fatigue can happen up to 16% of the time, and fever may come in at 12%. The more rare but serious side effects would be Stevens-Johnson syndrome, drug-induced encephalopathy, and metabolic acidosis. That's all we're going to talk about today with Topiramate or Topamax. As always, I'm very thankful you took the time to come by and watch one of my videos. If you did find the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.